This is Health Broadcasting Service HBS Radios, your global pioneers in specialist radio broadcasting, bringing you everything to enhance your health and well-being. Health is your human right. HBS, your partners in everything about your health and well-being.
HBS Radio is who you're looking for.
Weekly news update coming to you from the Health Broadcasting Service HBS radio channel. A quarter of symptomatic kids hit by long COVID. mRNA shots provide best protection in breast milk. A summary of some recent inconclusive studies on COVID-19 which warrants further study to corroborate the findings that has yet to be certified by peer review, revealed that 1 in 4 kids with COVID develop lingering problems. 1 in 4 children with COVID-19 symptoms develop long COVID, according to data pooled from 21 earlier studies conducted in Europe, Asia, Australia, and South America. Among the 80,071 children with COVID-19 in the studies, 25% developed symptoms that lasted at least 4 to 12 weeks, or new persistent symptoms that appeared within 12 weeks, researchers reported on Sunday on medRxiv ahead of peer review. The most frequent problems were neuropsychiatric, mood symptoms, fatigue, sleep disorders, headaches, cognitive alterations, dizziness, balance problems, cardiorespiratory, breathing difficulty, congestion, exercise intolerance, chest pain and tightness, cough, irregular heart rhythm, skin-related, excessive sweating, itchiness, hair loss, and gastrointestinal, abdominal pain, constipation, diarrhea, vomiting, and nausea. Analyses of data pooled from many different studies with different methodologies cannot yield firm conclusions, the researchers acknowledge. What is clear, however, is that children and adolescents have also physical and mental health consequences derived from COVID-19, said study co-author Sonia Villapol of Houston Methodist Research Institute in Texas. Identifying the main signs and symptoms of pediatric long COVID can help diagnose, develop better treatments, create multidisciplinary teams for optimal clinical management, and find risk factors for prevention. Vaccine protection in mother's milk strongest after mRNA shots. Women who wish to pass protective antibodies induced by COVID-19 vaccines to their babies via breast milk should opt for the mRNA shots from Moderna, mRNA, or Pfizer, PFE, BioNTech, according to a study reported on Monday in JAMA Pediatrics. For the study, 124 lactating women each provided 17 milk samples over a period of 100 days. The women had received either an mRNA vaccine or a vector-based vaccine from Johnson & Johnson, J&J, or AstraZeneca, AZN.L. Researchers measured 2 types of antibodies in the milk samples, IgA antibodies and IgG antibodies, both of which are thought to play important roles in protecting breastfed infants. Nearly all, 96% to 97% of the women who received both doses of an mRNA vaccine had detectable IgA antibodies in their milk, while only 39% had antibodies in their milk after 2 doses of the AstraZeneca shot and 48% after the 1-dose J&J vaccine. All the women who received both doses of the Pfizer or BioNTech, Moderna or AstraZeneca vaccines had IgG antibodies, compared to only 28% of women who received J&J's shot. An mRNA-based COVID-19 vaccine is the optimal choice for lactating women when they want to transfer breast milk antibodies to their infants, the researchers concluded. Omicron is infectious on surfaces longer than original virus. Omicron particles remain infectious on surfaces for longer periods than particles of the original SARS-CoV-2, according to laboratory experiments. Researchers put droplets of infectious virus from the original coronavirus version and the Omicron BA.1 variant on a variety of surfaces at room temperature. On smooth surfaces, glass, stainless steel and plastic sheet, Omicron was still infectious after 7 days, whereas particles of the original SARS-CoV-2 were no longer infectious on stainless steel and plastic sheets by day 4 and on glass by day 7, the researchers reported on Thursday on bioarchive ahead of peer review. On tissue paper and printing paper, the original virus was no longer infectious at 30 minutes. Omicron was still infectious at 30 minutes, but no longer after an hour, the researchers said. For the most part, SARS-CoV-2 is transmitted via respiratory droplets in the air. While infection via contact with contaminated surfaces is less common, the new study highlights the importance of hand hygiene and cleaning on surfaces that are regularly touched by different persons, said study co-author Leo Poon of the University of Hong Kong. For surfaces and settings contaminated by a COVID-19 patient, proper cleaning should be. In the next story, France's COVID infections keep rising, hospitalizations up. French health authorities reported 18,853 new COVID-19 infections on Monday, a figure showing a week-on-week increase for the 10th consecutive time on the day France lifted most of the restrictions put in place to contain the pandemic. The 7-day moving average of new cases, which evens out reporting irregularities, reached 65,882, the highest since February 24. The number of people hospitalized for COVID-19 rose by 8 to 20,925, a figure still 37% lower than the pandemic peak of 33,497 reached in November 2020. But it has gone up for the second day running, a first since early February. And the week-on-week decrease has been decelerating for 9 days. A change in trend in infections is usually visible 2 weeks later in hospitalizations figures. The COVID-19 death toll went up by 185 over 24 hours, the steepest rise in 10 days, to 140,294. Britain to ditch last COVID travel measures on Friday, says Minister. Britain will ditch the need for incoming travellers to fill in a passenger locator form, removing the last remaining COVID-19 travel measures from Friday, Transport Minister Grant Shapps said on Monday. All remaining COVID travel measures, including the passenger locator form and tests for all arrivals, will be stood down for travel to the UK from 4 a.m. 4 o'clock GMT on the 18th of March, Shapps said in a tweet. These changes are possible due to our vaccine rollout and mean greater freedom in time for Easter. U.S. agency fines more than 900 maskless air transit passengers. The United States Transportation Security Administration, TSA, has proposed $644,398 in fines for 922 COVID-19 mask violators since February 2021 on commercial flights, in airports and train stations, or on public transit services, the government reported on Monday, a dramatic jump in recent months. According to the government report, all but 44 of the TSA fines were for failing to wear masks as required on airplanes, or, less often, in airports. The rest covered unmasked passengers in surface transportation like transit, rail and bus. The agency said it has also issued warnings to more than 2,700 travelers, after more than 7,000 reported incidents, since the transit mask requirements took effect. In late October, TSA said it had proposed $85,990 in fines for 190 mask violators, and issued warnings to more than 2,200. Last week, TSA said it was extending mask requirements at airports and on airplanes through April 18. Since the start of 2021, the Federal Aviation Administration, FAA, has investigated reports of 6,800 unruly airplane passengers, including about 4,800 for not wearing masks. It has opened 450 investigations and proposed more than $5 million in fines. Next, the TSA fines included $501,388 for 788 onboard air incidents, averaging $636. The TSA has issued 18 civil penalties for not wearing masks at airport checkpoints, totaling $57,065, or $3,170 on average, and 160 others at airports, totaling $57,795, the Government Accountability Office, GAO, report said. Another 44 have been issued for surface transportation incidents, totaling $28,150. Last year, 2 U.S. lawmakers in the House of Representatives disclosed TSA had issued just $2,350 in total fines to 10 passengers through mid-September, despite thousands of reports of travelers failing to comply. TSA in November issued an information circular for aviation transportation operators detailing type of information needed for an investigation and best practices for obtaining information, such as from witnesses to incidents, the GAO said. And finally, in this news segment, births in Italy hit record low in 2021, population shrinks. Births in Italy dropped below 400,000 for the first time ever in 2021, Statistics Institute Istat said on Monday, while the overall population fell by more than 250,000 as the COVID-19 pandemic continued to weigh. Istat said 709,035 people died in Italy in 2021, some 30,000 fewer than in 2020, but still 9.8% above the average of the 2015 to 2019 period. Deaths attributed to COVID-19 in 2021 accounted for some 59,000 compared with more than 77,000 the year before, when COVID vaccines were not yet available. A total 156,868 deaths linked to COVID-19 have been registered so far in Italy, the 8th highest tally in the world. Demographics experts say the pandemic has hastened a decline in Italy's birth rate, with 399,431 births registered in 2021, against 404,892 in 2020. The 13th consecutive yearly fall and the lowest number since the unification of Italy in 1861. The total population fell by 253,091, taking into account births, deaths and migration flows, to 58.98 million in 2021, Istat said. Pope Francis last year bemoaned Italy's plunging birth rate, warning that the decline was a demographic winter that represented a threat to the future of the country. Feel free to connect with us on our Facebook platform, at Health Broadcast, and our website at www.healthbroadcastingservice.com. And please remember to press the subscribe button to stay abreast of timely, vital and authentic health news developments from around the world, delivered to you by the Health Broadcasting Service on YouTube channel. We will bring you more updates as news develop. Stay safe, remain healthy, and bye for now.
You've been watching the Health Broadcasting Service YouTube channel, your channel of excellence and distinction. Pioneering specialist radio broadcasting, giving you the best experience. Subscribe to our channel.